Heartburn. Aha, that familiar, uncomfortable burn in your chest. It's super common, but it can also be your body's way of trying to send you a message. So today we're going to dive into what's really happening, when you need to pay close attention, and of course, the best ways to get some relief.
You know exactly what I'm talking about. You've just finished a fantastic meal. Maybe it was a little spicy, maybe a little rich, and then it starts. That slow, creeping, burning feeling right in your chest. If that sounds all too familiar, you are definitely in the right place. We are going to get to the bottom of this. Okay, first things first, let's get our terms straight, because that feeling you just called heartburn might be exactly that. Or it could be a piece of a slightly bigger puzzle. And, understanding the language here is really the first step to figuring out what your body's trying to tell you. This chart does a great job of clearing things up. So, heartburn is that classic burning feeling. Simple enough. But if that's happening a lot, and it's paired with acid coming back up, well, that's when doctors call it GRD. And then there's this other term, dyspepsia. Think of that as more of a catch-all for feeling way too full, bloated, or even nauseous after you eat. So you see, they're all related, but they're not quite the same thing. So why does this even happen? I mean, it's so easy to just blame that extra slice of pizza, but the truth is, the list of what can trigger it is, well, it's surprisingly long. It's usually a mix of what we eat, how we live, and maybe something else going on under the hood. Let's start with diet, because that's often the #1 culprit. And yeah, you're looking at a lot of the usual suspects here. Things like coffee, citrus, and alcohol can actually relax a little valve that's supposed to keep stomach acid where it belongs. Meanwhile, fatty or spicy foods can just make your stomach produce more acid. It's a real minefield of delicious things, unfortunately. And, it's not just what you eat, it's also how you live. Stress? Oh yeah, that is a huge trigger for so many people. Same with smoking. Even things that seem totally unrelated, like a high-impact workout, lying down too soon after eating, or even just wearing pants that are a little too tight around the waist can set it off. And finally, we've got to look a little deeper. Sometimes an underlying condition like obesity or something called peptic ulcer disease is the real root cause. And some really common medications like NSAIDs, stuff like ibuprofen, or even just iron supplements can be the trigger. It just goes to show how many different pieces can be part of this puzzle. Okay, so we know what it is, and we have a pretty good idea of what might be causing it. But now we're at, without a doubt, the most critical part of this whole conversation, knowing when this is something you can handle yourself and when you absolutely need to call a doctor. Look, this isn't about scaring anyone. This is about empowering you. Having mild heartburn once in a blue moon is one thing, but when it's persistent or severe, that can actually be a red flag for something more serious. It's so important to listen to your body. So let's be crystal clear about when you should not try to treat this on your own. You need to see a doctor if your heartburn has been hanging around for more than 3 months, or if you've been taking over-the-counter meds for 2 weeks and nothing's changed. Same goes if your symptoms are just plain severe, or if they're waking you up at night. And here's a big one. If you're over 45 and this is a brand new problem for you, that's your cue to get it checked out. And that brings us to something called alarm symptoms. This quote really says it all. These aren't just little annoyances. These are signals, potential signs that something more serious is going on that you need to address. Okay, let's break down the first one. Dysphagia. It's a fancy medical term, but it just means you're having trouble swallowing. If you feel like food is getting stuck, or if it's actually painful to swallow, that is an immediate time to call the doctor situation. No question. Next up is unexplained weight loss. If you are shedding pounds without even trying, and it's happening alongside these heartburn symptoms, well, that's another major alarm bell that absolutely needs a professional look. And finally, anything that involves vomiting or any sign of bleeding is an urgent alarm symptom. This is not something to wait on. It requires immediate medical attention. Seriously. All right. So let's say you've gone through that checklist, you don't have any alarm symptoms, and it looks like self-care is a good option for you. Where do you even start? Well, the good news is there are some really powerful things you can do that don't involve any medication at all. Here are 4 game-changing habits to try. First, become your own detective. Keep a little diary to figure out your personal food and lifestyle triggers. Second, create a no-food zone for 2 to 3 hours before you go to bed. Third, if it's a factor for you, even losing a small amount of weight can make a massive difference. And fourth, a simple mechanical fix. Just prop up the head of your bed with a few blocks or a wedge pillow. Now, if those lifestyle changes just aren't cutting it, there's a whole aisle at the pharmacy just waiting for you.
But wow, there are a lot of choices. So which one is right for you? Let's break down the main options. Probably the easiest way to think about all these boxes on the shelf is a simple trade-off: speed versus endurance. On one side, you've got stuff that works incredibly fast for that right now on-the-spot relief. And on the other side, you have options that take a little longer to kick in, but are really designed for longer-lasting prevention. First up, we have the antacids. The best way to think about these is like a fire extinguisher for that fire in your chest. They don't prevent the fire from starting, they just show up and put it out immediately by neutralizing the acid that's already there.
And their superpower? Speed. Pure and simple. We're talking relief in less than 5 minutes. That's why, for that sudden, oh no, I need help right now moment, antacids are the undisputed champion. Next up are the H2RAs. You probably know them by brand names like Pepcid or Zantac. Now, instead of just putting out the fire, these guys work on prevention. The analogy I like is that they go to the source and turn down the faucet on the cells that produce acid in your stomach, giving you relief that lasts anywhere from 4 to 12 hours. And then we have the heavy hitters, the PPIs, or proton pump inhibitors, like Prilosec and Prevacid. If H2RAs turn the faucet down, these PPIs put a serious clamp on it. They dramatically reduce acid production for a full 12 to 24 hours. Just remember, these are for prevention, not for that instant, I ate the wrong thing moment of panic.
And of course, we have to give a shout out to the famous pink stuff, right? Bismuth subsalicylate, which pretty much everyone knows as Pepto-Bismol, is kind of a Swiss Army knife. It helps with heartburn, for sure, but also indigestion and a generally upset stomach, making it a pretty useful thing to have around.
So, as we wrap things up here, I want to leave you with this question. Instead of just thinking of heartburn as this annoying thing you need to crush, what if you thought of it as a message, a little signal from your body about your diet, maybe your stress levels, or your lifestyle? So the question is, what is your heartburn trying to tell you?